Hi guys, we're going to talk about chapter 24, and this is going to cover all of our personality disorders for this chapter, and we are just going to get started here. So when we look at the terminology for personality, it comes from the Latin word persona, meaning mask. Individuals' characteristic pattern of relatively permanent thoughts, feelings, and behavior. This defines their quality of experiences and relationships. A person is considered unhealthy when interpersonal and social relationships and functioning become maladaptive, complicated, or dysphoric. Personality disorders are the most challenging and complex group of disorders to treat individuals who meet the criteria for these disorders. Significant challenges in self-identity or self-direction. They have problems with empathy and intimacy. And it is broken down into 3 clusters of similar behavioral patterns and personality traits. So you can see cluster A are our odd and eccentric behaviors. So those are our paranoid, schizoid, and schizotypal. Cluster B are our dramatic, emotional, and erratic behaviors, and that's going to include borderline, narcissistic, and histrionic, and antisocial. And then the last cluster is cluster C there, and those are our personality disorders that are going to display anxiousness and fearful behaviors, and those are avoidant, dependent, and obsessive compulsive. So let's look specifically at cluster A personality disorders, and we can remember those behaviors are going to be eccentric and odd, and that's our paranoid, schizoid, and schizotypal. So paranoid personality disorder is characterized by a long-standing distrust and suspiciousness of others. They believe that others want to exploit, harm, or deceive them. They are very hypervigilant, and they anticipate hostility and may provoke hostile responses. They also are very reluctant to share information because they fear it will be used against them. The prevalence is about 2 to 4%. It's usually greater seen in males than in females, and it often precedes a schizophrenia diagnosis. Some of the characteristics that we might see is apparent in childhood or adolescence. Usually these are the kids with no friends. They have social anxiety. They might be frequently teased, especially in that social setting. Relationships are very difficult due to that jealousy and their controlling behaviors. They are unwilling to forgive. Projection is the dominant defense mechanism. As far as treatment, remember these are very mistrusting, so following through with promises and adhering to schedules is going to be very imperative for nurses. We do want to avoid being overly friendly. If we are too friendly, that may create some suspicion with these patients. We want to project a neutral, kind effect, give clear, straightforward explanations. We'll use simple language, making sure we're limit setting. That's going to be essential. And as far as psychotherapy, it can be the first treatment for paranoid personality disorder. Individual therapy helps develop professional and trusting relationships. Group therapy may be threatening. However, social skills may be improved in that setting. Short-term antidepressants may be used to help with this paranoid personality disorder. And you can just see the mnemonic here, get fact, and that's just going to again walk you through some of those characteristics that you're going to see. When we look at schizoid personality disorder, they are going to exhibit a lifelong pattern of social withdrawal. They are expressionless. These individuals people will describe them as being odd or eccentric because of how uncomfortable they are in that social situation. About 5% of our population is the prevalence, and again, males greater than females. Some of the characteristics, again, we're going to see this in childhood and adolescence, and these are our loners. They do poor in school. They're the objects of ridicule because of those odd behaviors. They don't seek out close relationships. They have numerous imaginary friends and fantasies, and they are considered an observer rather than a participant in life. They have feelings of depersonalization or detachment from oneself and the world. Some of the guidelines that we can think about for nurses is, again, avoiding being too nice or friendly. Don't try to increase any socialization. They're just usually not ready for any of that. Assess for symptoms the patient is reluctant to discuss, and then make sure you're protecting them if they are in group therapy, that they're not being ridiculed. Treatment can include psychotherapy. This can help improve sensitivity to others' social cues. Group therapy may be helpful even though they may be silent. It gives them that opportunity to practice those interactions. Antidepressants will be your drug of choice, and it can just increase pleasure in life. Antipsychotics could be utilized as well, and that might just improve some of those emotional expressiveness. And then here's just another mnemonic for schizoid personality. Remember, these are loners, odd, eccentric, so you can just kind of visualize that loner guy behind his chair there. And Sir Safe can help with some of those characteristics that you will see. Schizotypal personality disorder do not blend well with the crowd. Symptoms are strikingly strange and very unusual. These are your magical thinkers. He caught a cold because I wished he would. They have odd beliefs, meaning they're overly superstitious. Strange speech patterns and inappropriate affect are the hallmark symptoms of this personality disorder. Prevalence varies from about 0.6 to 4.6 in the population. Again, males greater than females. Characteristics have severe social and interpersonal deficits, anxiety in social situations. They have rambling conversations. They will ramble with lengthy, unclear, overly detailed, and abstract content. They'll display paranoia, suspiciousness, anxiety, distress. The motivation of others is being out to get them. They can be made aware of their own odd beliefs, suspiciousness and magical thinking, and a lot of times these are the patients that you're going to see in those cult groups, involved in cults or unusual religious or supernatural beliefs, things like that. As far as nursing care guidelines, we want to respect our patient's need for that social isolation, be aware of and intervene appropriately with patients' suspiciousness, perform careful diagnostics, making sure that we're looking for any suicidal thoughts so that we can keep them safe. And then just make sure you're withholding any judgment or ridicule, or if they're in a group setting, that you're being aware of any ridicule that could be going on. Be aware that strange beliefs, strange religious practices, peculiar thoughts may be part of that patient's life. So again, just being aware of the judgment and ridicule that could go along with that. With treatment, psychotherapy, we want to investigate possible involvement with those cults or unusual religious groups. There's really no medications associated with treatment. They can do a low dose of antipsychotics, and that might just help with some of the symptoms to get them through their just day-to-day functioning. So another mnemonic here is that UFO aider, and again, it's just giving you a recap of those characteristics. And I do have a question here for you. A client diagnosed with paranoid personality disorder becomes violent on a unit. Which nursing intervention is most appropriate? And I'll let you read over that and think about it. And the answer is C. We want to use clear, calm statements and confident physical stance. That is the most appropriate nursing intervention with this patient population. A calm attitude avoids escalating the aggressive behavior and provides the client with a feeling of safety and security. It may also be beneficial to have sufficient staff on hand to be present as a show of strength. So that concludes personality cluster A. So now we will move into cluster B here. And remember, these are our dramatic, emotional, and erratic behaviors. So the personalities disorders that we're going to talk about with this cluster are histrionic, narcissistic, antisocial, and borderline. So when we look at histrionic personality disorder, the prevalence is about 2% of our population. With this one, it's usually females are greater than males. Some of the characteristics include excitable, they're dramatic, but they're very high functioning. They usually are referred to as those drama queens or drama majors. They have a very bold external behaviors, they're extroverts, they're flamboyant, and they have very colorful personalities. Despite that bold exterior, they do have limited ability to develop those meaningful relationships. They're very attention-seeking, self-centered, low frustration tolerance, often impulsive and may act flirtatious or provocatively. Relationships that they do make usually do not last because the partner feels very smothered. This individual has no insight into the disorder or role in breaking up that relationship. So some of the guidelines we can think about as far as nursing care, we know that seductive behavior is a response to some type of distress. We want to keep those interactions very professional and ignore any flirtatious comments. We want to model that concrete language, clarify any inner feelings, and then teach and role model assertiveness. Treatment is going to include individuals with this histrionic personality disorder may be out of touch with their feelings. So we'll do some psychotherapy to help promote clarification of inner feelings and appropriate expression. Group therapy may be helpful, but could be very distracting with some of the flirtatious symptoms, disruptive symptoms that might be going on. And then there's really no specific pharmacological treatment for this disorder. So mnemonic for this one is I crave sen, and you can see the different characteristics again as a recap. Narcissistic personality disorder is a 0 to 6% prevalence, males greater than females. Characteristics include feelings of entitlement, exaggerated belief in one's own importance. They have a lack of empathy, and with the combination of these, that may result in exploitation of others. So in reality, they may suffer from a very weak self-esteem and hypersensitivity to criticism. They can come across as very arrogant and having an inflated view of self. They have an importance with that high need of constant admiration. They usually put lots of strain on relationships, especially over time. Individuals with this disorder have less functioning impairment other than other personality disorders. Underneath all of this arrogance, they have intense feelings of shame and fear of abandonment that could be felt. So some of the guidelines, we want to remain neutral, make sure we're avoiding any power struggles because they could become very defensive, and then just role model that empathy. They have not an empathetic bone in their body. So if we can role model that, hopefully they can see that empathy. As far as treatment, it is difficult because we need our patients to confront their problems in order to make progress. Because these individuals are not likely to seek help, they may be more involved in couple or family therapy rather than individual therapy. Cognitive behavioral therapy, or that CBT, is helpful for deconstructing that faulty thinking. Group therapy can also help see their own qualities in others and help to learn that empathy. Lithium has been used for some of those really mood swings. And we can also think about antidepressant meds for symptoms of any depression. So narcissistic mnemonic is a fame game, right? They're all about themselves, very arrogant, to the point where they might be exploiting others. So the fame game is that mnemonic that you can try to remember for characteristics for this one. Antisocial personality disorder has a significant social impact. This is a pattern of real disregard for and violation of the rights of others. These individuals are commonly referred to as sociopaths. Characteristics, the main pathological trait that characterizes antisocial personality disorder are those antagonistic behaviors. That's deceitfulness, manipulation for personal gain, or hostile if their needs are blocked. It's also characterized by disinhibited behaviors, such as high risk taking, disregard for responsibility, and impulsive. Criminal misconduct and substance abuse are very common in this population. They have a profound lack of empathy, known as callousness, which is just that total lack of concern about the feeling of others. They have absence of remorse or guilt unless they're facing some type of punishment. Total regard for others' obligations. They exhibit shallow, unexpressive, and superficial affect. They may also adapt themselves to portray concern and caring if these attitudes can help manipulate and exploit others. So when we think about assessment of these patients, individuals with antisocial do not seek treatment unless they are court-ordered to. So if we're keeping that in mind, questions may not be answered honestly, and individuals may become very defensive. With these patients, you really want to make sure you are self-assessing. Remember that these individuals may be very charming, so you may find that you are defending or feel like they are being treated unfairly. Nurses may also be very aware of their criminal history and feel threatened. These feelings need to be explored with faculty or other experienced staff. Some of the nursing diagnoses you can see listed there, they're really going to be geared towards maintaining that safety and providing structure. Outcomes, those are your goals, right, for your patient. So the success of achieving these outcomes is difficult with this population of individuals. Again, maintaining safety is priority. We're going to do very small steps, and hopefully those changes will be seen and they're going to lead to progression. As far as planning and implementation, we're going to set very clear boundaries and be consistent with those boundaries. We're going to support these patients and set very structured limitations. That's going to be essential for all staff members to follow. Remember, these patients will attempt manipulation if they're not getting what they want. So making sure that we can provide realistic choices will help enhance adherence. You can go to this group therapy today or this one. So very realistic choices, but they've got to do one or the other to try to enforce that adherence to those therapies. Teamwork and safety. Safety, again, is going to be prime consideration. All team members have to be consistent with that treatment plan because they might be manipulated. So making sure that everybody is on board. As far as pharmacological interventions, they may respond to mood stabilizers such as lithium or valproic acid to help with aggression, depression, and impulsivity as well. So antisocial mnemonic is the callous man. Remember, they have callousness, so that just lack of empathy. So these are some of those characteristics you might see. And then if any of you have watched The Simpsons, you will recognize this character here as an antisocial personality disorder. Lack of empathy, little regard for others' feelings. They view the world as a hostile. They don't usually think about the consequences of their actions, and they will lie and steal, so they're prone to that criminal behavior. All right, borderline personality disorder is the last one in this cluster. It's the most well-known and dramatic of these personality disorders, usually characterized by severe impairment in functioning, very marked instability in emotional control, impulsivity, self-image distortion, unstable mood, and interpersonal relationships. The primary feature for borderline is emotional liability, impulsivity. Emotional liability is that rapid movement between emotions. Emotions could be out of proportion to the circumstance, pathological fear of separation, or intense sensitivity to personal rejection. And then that impulsivity is they act quickly in response to the emotion without any consideration to the consequence. Sometimes these patients are very self-destructive and have those behaviors that are very prominent. So self-soothing and harmful, meaning there might be cutting, they have promiscuous sexual behaviors, substances that are numbing can cause unintentional death. So they're trying to self-soothe, but those self-soothes are harming for them. Feelings of antagonism can be hostile, angry, and irritable in relationships. And then unusual feature for this one is splitting. So the splitting is just that inability to view both a positive and negative aspect of others as a part of the whole. So you are either very wonderful, or you are the worst human being alive. Prevalence is about 1.6%. As far as epidemiology, they do have a high mortality rate. About 10% of them come from suicide. 85% meet diagnostic criteria for another psychiatric disorder. Etiology, it's 5 times more common in first-degree biological relatives. And disruption in separation from parents can cause that inability to find individuation. So when we apply the nursing process for this one, we start with our assessment. We're going to start with a semi-structured interview. We're going to use self-report inventory, such as an MMPI, because they have built in that validity and reliability scale to interpret those results. We also want to make sure we're doing a lot of self-assessment if we're working with these patients. You can see the nursing diagnoses there. Individuals are admitted because of symptoms of comorbid disorders or dangerous behaviors. Some of the outcomes and planning that we can think about. A realistic outcome needs to be individually established to measure improvement. So improvement in mutilation, improvement in aggression, improvement in those suicidal thoughts. A therapeutic relationship is essential with this patient population. Remember, most of these patients have experienced a failed relationship. Make sure you're aware of manipulative behaviors such as flattery, seductiveness, and guilt implementation. And guilt. As far as implementation, we're finding the best approach that works with the patient in the setting in which they are treated. And that's going to be very, very important. With these patients, remember they have no impulse control. So make sure we are being clear and consistent with our boundaries and our limits. Use straightforward communication, very matter of fact. If the behavioral problem emerges, do calm review therapeutic goals. Talk to the teamwork, remembering that our primary goal is management of that patient's affect in a group setting. We can talk about coping skills. Socializings are helpful also for these patients. As a nurse, taking care of these patients that may have self-inflicted wounds, you want to just respond very matter-of-factly when you're reassessing or you're rebandaging. We don't want to provide any positive reinforcement for that self-mutilation. As far as pharmacological interventions, there's really no medications that are very specifically approved. Psychotropic mood stabilizing medications are geared toward just maintaining some cognitive function, symptom relief, and improved quality of life. Advanced practice, again, this isn't something you'll be required to do, but you may help with, and you just may be helping assist staff in therapeutic alliance. As far as psychotherapy, CBT can help individuals identify and change perceptions of themselves and others. Dialectical behavior therapy, or that DBT, is mindfulness therapy. That's just helping them be more aware of their thoughts and reshaping them. They can also help individuals manage distress and improve interpersonal relationships. Schema-focused therapy is reframing the way they see themselves. So borderline mnemonic here is I raised a pain, and then again, it's just going to recap some of those characteristics that we just talked about. All right, last cluster here is cluster C, and these are, if you remember, are anxious and fearful behaviors. So we're going to look at avoidant, dependent, and obsessive compulsive. Remembering that the background of these are anxious and fearful. So when we look at avoidant personality disorder, these patients are extremely sensitive to rejection. They feel inadequate and are socially inhibited. They want to avoid personal contact due to fear of rejection or criticism. The prevalence is about 2.4%, and it's really equal between males and females. As far as characteristics, early symptoms can be seen in infants and children. They can be very shy, and that increases through that adolescence. They usually have low self-esteem with that inability to function in social situations, again, because of fear. That feeling of inferiority, they're reluctant to engage with new people in unfamiliar environments. If their support system fails, they can suffer a great deal from depression, anxiety, and anger. They are very preoccupied with rejection, humiliation, and failure. Some of the nursing guidelines that we can think about: friendly, accepting, reassuring approach. Remember, being pushed into social situations can cause a lot of anxiety. So we want to make sure we convey an attitude of acceptance of those fears. Provide exercises to help enhance new social skills, but use caution because failure can increase feelings of poor self-worth. Assertive training can help one to learn how to express their needs. As far as treatment, individual and group therapy is useful for anxiety-provoking situations and then how to handle them. Anti-anxieties can be helpful to reduce hyperactivity. Antidepressants may reduce social anxiety and help them feel less sensitive to that rejection. So our mnemonic for this one is ridicule. And again, you will just see those characteristics we kind of chatted about. Dependent personality disorder is a pattern of submissive and clingy behaviors related to just an overwhelming need to be taken care of. This can result in intense fear of separation. Only about 0.5% prevalence. Characteristics are high need to be taken care of, which leads to patterns of submissiveness with fears of separation and abandonment by others. Because of these patterns, they may manipulate others to assume responsibility for activities related to finances or child rearing. Intense anxiety when they are left alone, even if it's just for a very brief period of time. Some guidelines for nursing care. We want to help identify and address those stressors, set limits that don't make the patient feel punished, be aware of countertransference because the patient's demand for extra time and crisis state of mind. We want to role model that assertiveness. When we think about treatment, psychotherapy is that treatment of choice. Cognitive behavioral therapy, again, healthy thinking and challenging thoughts could result in those fearful behaviors. So we can think about that therapy. There's really no medications for this one. So dependent personality is darn hurt, is that mnemonic for you there. And then the last one we're going to talk about is obsessive compulsive personality disorder. And this is usually characterized by limited emotional expression, stubbornness, perseverance, and indecisiveness. They are preoccupied with orderliness, perfectionism, and control. The difference between obsessive compulsive disorder, which were those obsessive thoughts and repetition to rituals, versus obsessive compulsive personality disorder is just that unhealthy focus on perfectionism. Prevalence is about 2 to 8%, males greater than females. Older siblings are usually greater than subsequent siblings. Some of the characteristics that we might see, main pathological personality trait is that rigidity and inflexible standards for themselves and for others. Again, it's that perfectionism. They rehearse over and over how they are going to respond in a social situation. They persist in excessive goal seeking long after it's necessary, even if it's just self-defeating or relationship defeating. They are preoccupied, or their preoccupation results in losing the point of the activity. Strict standards will make projects incomplete or overdue. So these are your people at work that just can't get the project done correctly because it's not perfect. So it's going to be incomplete or maybe not due on time. They usually will make unhealthy focus of that perfectionism. Guidelines for nursing. We need to make sure we're guarding against those power struggles. The need for the control is really high with them. Remember that the patient has difficulty dealing with unexpected changes. So make sure we provide structure, but allow some extra time to complete any of those habitual behaviors. As far as treatment, patients do seek help because they are aware that they are suffering. They also seek treatment for anxiety and depression. Group therapy and behavioral therapy can be helpful with learning coping skills. Clomipramine and Prozac are your medications there, and they can help reduce some of those obsessions, anxiety, and depression. So last one here for obsessive compulsive personality, low mirth, and again, it's just going to give you some more of those characteristics that we've talked about. So I really like the parking lot of personality disorders, and this is located in Moodle for you. And you can just kind of match up your cars with the personality disorder. And again, it's just going to show you those different personalities from this perspective. So if you're looking at number 1, paranoid, right, they're cornered again. Somebody's cornered them, they're paranoid. Where like 7, the histrionic, they're parked in the center. They want to be the center of attention. They want all eyes on them. So I thought this was just kind of a fun, different way to look at it there. And that concludes chapter 24 on personality disorders. If you have any questions, we will chat about it in class. Thanks, guys.